Welcome back to the Meet Mom podcast. I'm your host, Dr. Alexia Priello, naturopathic doctor. On today's episode, I'll be discussing cervical ripening and labor induction, as I often see people in the clinic during the last couple weeks of the third trimester hoping to avoid an induction and are wanting natural techniques to help get things going. Let's first differentiate between cervical ripening and labor induction. Cervical ripening is the process of getting the cervix ready for labor. We want the cervix to soften, thin, and begin to open, otherwise known as dilate, so the baby can pass through during birth. This can happen naturally as the body prepares for labor, or it can be helped along with medications like misoprostol or mechanical methods like a balloon catheter. If the cervix isn't ready, something called the Bishop score is used to help determine how ready it is for labor. It looks at five features: dilation, how open the cervix is; effacement, how soft the cervix is; consistency, or how soft the cervix has become; consistency, how soft or firm the cervix feels; position, where the cervix is pointing; and station, how low the baby's head is in the pelvis. Each feature is assigned a score with a possible total of 13. If the score is 8 or more, the cervix is favorable or ready for an induction. However, if it's 7 or less, the cervix may need ripening prior to induction. Now, labor induction is the process of starting labor artificially. This means encouraging the uterus to contract before labor begins on its own. If the cervix isn't ready, induction might involve cervical ripening followed by medications like oxytocin or breaking the water to bring on contractions. Labor induction is usually in certain circumstances, like when pregnancy goes past the due date, or if the water breaks prior to labor starting, or if there are health concerns such as high blood pressure or slowed baby growth. A successful induction is based on a few factors, including how ripe the cervix is and if the pregnant person has had a previous vaginal birth. There are a few ways to ripen the cervix and induce labor, and they include the use of pharmaceuticals, mechanical methods, or a mix of both. Now, let's start with the pharmaceuticals that help to soften the cervix and begin contractions. The first are prostaglandins, such as misoprostol or dinoprostone. Pharmaceuticals like these help prepare the cervix and start contractions. Misoprostol is often given in small doses by mouth or vaginally, while dinoprostone is available as a gel or vaginal insert. You've also likely heard of oxytocin, also known as Pitocin, given through an IV, which is the most widely used agent for labor induction. Effectiveness actually varies between person to person, which is why you might have heard a variety about a person's induction experiences. Effectiveness of the Pitocin varies on the uterine receptivity of oxytocin receptors. Caution is needed in people with a previous C section because of the possibility of a uterine rupture. However, certain OBs will still use oxytocin, but likely at a smaller dose. Lastly, mifeprostone and nitric oxide donors are sometimes used, but not always. I personally tried nitrous oxide during my VBAC, and I really disliked the taste to the point where I was like, I don't want to use this. And it didn't really work a ton for me, likely because I couldn't tolerate it a lot. Sometimes mechanical methods are used to open the cervix, and the most common method that many OBs and midwives use, in my experience, are membrane stripping, otherwise known as a stretch and sweep. This is done by obstetrical care providers by sweeping a glove finger across the membranes that connect the amniotic sac to the wall of the uterus. Now, separating the membranes promote the release of prostaglandins. Sometimes this isn't done, likely in the presence of an active infection or if someone is GBS positive. I usually see most OBs begin stretch and sweeps around 38 weeks, while midwifery's clients will usually have them started around 40 weeks. In comparison to prostaglandins, the first line method used is the balloon catheter. Now, this is a small tube that's inflated in the cervix to assist with its opening. It's as effective as medication and has a lower risk of overly strong contractions. Mechanical methods use physical forces downwards for the Foley catheter to dilate the cervix. It's avoided in rupture membranes, and I'll find that many of my clients will start with the balloon or Foley catheter once their induction date approaches. Lastly, breaking water can be used as a mechanical method. This is when inaccessible membranes are caught and ruptured by a plastic hook. This goes ahead and stimulates oxytocin release, followed by a local release of prostaglandins. Before someone has their water broken, the fetal presentation and station does need to be confirmed. Now, combining methods is very common to help with labor induction. And honestly, aside from the balloon catheter, I personally had both the pharmaceutical and mechanical methods to induce labor. There are some at home approaches that can be used to help get things going. And while they have limited evidence, they still might be worth a try. Studies have suggested that nipple stimulation may result in the release of oxytocin from the posterior pituitary gland. This can be done around 3 times a day for an hour as needed manually or using a pump. It should be avoided though in a high risk pregnancy. And as always, if you're going to use these at home methods, it's best to check in with your OB or your midwife and even consult with your naturopathic doctor to determine if these are right for you. Having sex may be helpful as the seminal fluid contains prostaglandins that might help in softening the cervix. It can be performed as needed, but should be avoided in an infection, premature rupture of the membranes, and any abnormalities of the placenta. Consuming castor oil can be used for cervical ripening and labor induction, but the mechanism of action really isn't fully understood. Potential complications from castor oil include meconium stained fluid and maternal electrolyte abnormalities from diarrhea. A lot of people will use castor oil as a last resort, and I avoided using it personally because I just couldn't stomach the taste or the texture. It's if you've never seen castor oil, it's like very thick. I really couldn't imagine like swallowing it, although it is like mixed with like a nut butter and like some type of other juice to help make it more palatable, but I'm pretty sensitive to taste. Evening primrose oil is often used towards the end of the pregnancy, either by mouth or inserted vaginally to help ripen the cervix. It does have some complications like premature rupture of the membranes and meconium stained fluid, so it's best to speak to your healthcare provider before starting it. Dates are often used around starting around the 36th week of pregnancy to help improve the Bishop score. So this is going back to like cervical ripening. This should be avoided in people with gestational diabetes because of an increased sugar content. And honestly, like with dates, you don't always have to have them by themselves. I mixed mine with some nuts, some chocolate. I made like a homemade turtle. But then even having dates and like kale salads like are so good. There's so many ways to incorporate dates as part of someone's, daily diet, to be honest. Lastly, acupuncture showed a greater cervical change in Bishop's score and increasing cervical maturation, which results in spontaneous labor. You're likely not going to be doing acupuncture by yourself at home, though, but many naturopathic doctors and acupuncturists offer this. In my practice, I'll encourage patients to start coming in around 36, 37 weeks of pregnancy and continue weekly up until birth. I'll often teach them some acupoints that they can apply pressure to at home or get their partner to do so to help encourage cervical dilation and movement down the birthing canal. All right. So, thank you so much for listening to this episode about cervical ripening and labor induction. I really hope you found it informative. If you have been pregnant, have you used any of these at home tools or in office tools like acupuncture? Let us know in the comments. If you found this episode helpful, please consider subscribing to this podcast, leave a review, or follow me on Instagram. Thank you so much. I'll talk to you next time. Take care.